Today, everyone. I'm County Executive Joe Parisi. I'm joined by Mayor Satchio Conway and Janelle Heinrich, the Director of Public Health, Madison, Dane County, and some of her team from Public Health. I will speak, then the Mayor, then Janelle, and then we'd all be happy to take any questions you might have. The Supreme Court's decision to overturn Roe v. Wade has created a health care emergency for every woman and person who gives birth in Dane County and beyond. While it still seems surreal to say that abortion is now illegal in Wisconsin, it is all too real for every woman in our community. We may not be able to overturn that decision on the local level, but we can work within our public health framework to do everything in our power to ensure that women have access to health care services, including birth control, emergency contraception, and other reproductive health care. While public health already provides many reproductive health care services, including education, birth control, and emergency contraception, the need to expand those services has never been more urgent. In light of the unprecedented nature of this challenge, I will ask the Dane County Board to immediately allocate $360,000 from the county's General Reserve Fund to jumpstart the expansion of public health staffing, service hours, and additional services for women throughout Dane County, including the addition of long-acting reversible contraception to provide long-term pregnancy prevention. Once approved, these dollars will allow public health to immediately begin the process of hiring additional staff and making other arrangements to expand services in the next few months. Drawing from the county's General Reserve Fund, also known as our Rainy Day Fund, is a rare event, but the urgency of the moment calls for swift and decisive action. Beginning in 2023, the city and the Dane County will partner under the usual budget process to provide these additional services and resources on an ongoing basis at a cost of just over $1 million annually above the services that are already provided. Women in our community and throughout Wisconsin have had their rights taken away from them by a court that does not represent the views of the majority of people in our nation, our state, and certainly not in our community. And our gerrymandered state legislature perpetuates this travesty by upholding an archaic and sexist ban on allowing women to make their own health care decisions. Our community, our state, and our nation disagree with these policies and will continue to work to overturn them and put in place policies that are supported by the vast majority of the public. In the meantime, we will work here at home to make sure that preventative services that people want and need are available to them, and that women have every opportunity we can help provide to make their own health care decisions. I'm now going to turn it over to the Mayor. Thank you.
Thank you, County Executive, and thank you for your leadership on this issue. I really appreciate it when men step up on the issue of reproductive rights. Local government can't undo what the Supreme Court did. We can't make our state legislature do what they should do, but we can do our best to restore at least a small amount of control and choice to the women in Madison and Dane County. It's important for Public Health Madison-Dane County to offer these services so that women can have options in our community. The Supreme Court's decision and the Wisconsin legislature's failure to act to restore reproductive rights in Wisconsin will create adverse health care outcomes for many and will disproportionately impact BIPOC women in Madison and Dane County. We already see racial disparities in access to care and maternal and child health outcomes in our community. And these decisions will make those disparities worse. This expansion of public health services in our community will improve health outcomes. Comprehensive reproductive services like long-acting reversible contraceptions, an example is IUDs, are the most effective non-permanent contraceptive methods, and they are safe and effective for all ages and all body sizes. We know from work in other states that investments like this can improve health outcomes. In Colorado, improved access to reproductive health care services, and increased use of long-acting reversible contraception are associated with significantly lower risk of high-risk births, preterm births, teen births, and the need for abortion services. When these types of contraceptives become more readily available to low-income women in Colorado, they saw that their use amongst 15 to 24-year-olds increased from 5% to almost 20%. Teen birth rates declined more rapidly than in any other state. That was a 40% decrease in teen birth rates. High-risk births decreased by 24% within 2 years, and abortion rates fell 42% among 15 to 19-year-olds and 18% among 20 to 24-year-olds. Those are some pretty remarkable numbers. If we can achieve similar outcomes here in Madison and Dane County, it will disproportionately support the health of Black women in our community. But let me be clear, our work is not done. We need access to a full range of equitable and evidence-based reproductive health care, including safe and legal abortion, to have healthy and thriving women, people that may become pregnant, children, families, and indeed our entire community. So as we continue to fight for reproductive justice, investing in preventative care and expanding comprehensive reproductive health care services, including low and no cost and easily accessible long-term contraception, is a crucial step. I want to thank again the county executive for his action on this and his willingness to invest county funds this year to make these services more available to people in Madison and Dane County. And now I'll turn it over to Janelle Heinrich, the Director of Public Health, Madison-Dane County.
Good morning. I'm happy to be here and to share with you information about this decision and to talk more about what Public Health Madison and Dane County can do. And I'm really grateful for the support of this community and these leaders and our ability to do so. At Public Health Madison and Dane County, we are committed to providing preventive, reproductive, and sexual health care to anyone who needs it. We believe access to a full range of equitable and evidence-based care is necessary for healthy and thriving people that may become pregnant, children, families, and communities. Our sexual and reproductive health clinic currently operates on a part-time basis, 16 hours per week, at our office on East Washington Avenue. We offer a wide range of sexual health services there, including STI testing, birth control, and emergency contraception at low or no cost. The majority of our services are currently focused on STI testing and follow-up, which happen outside of clinic hours. With this additional funding, beginning or by the end of this year, we will be able to expand our clinic hours up to 24 hours per week. This expanded capacity will help us reach hundreds more people each year. We will also be able to dedicate more time and focus on reproductive health care, outreach, education, and partner engagement. This includes offering pregnancy prevention options like long-acting reversible contraception, for example, intrauterine devices or IUDs. With a single appointment, we will be able to provide a safe, effective, and convenient method of reversible contraception that can be used for a long period of time. We know the benefits of providing free and accessible, comprehensive reproductive health services in our community. It supports individuals in being able to choose if and when they are ready to become pregnant. It improves health outcomes for those who may become pregnant and has been indicated to improve birth outcomes as well. It provides confidential care to support whatever decision is best for you. We are so grateful for the support and recognition of this work. We know that we are not alone in this community in providing care to our community, and we'll continue to work with our partners to ensure everyone's reproductive rights are protected and honored. And with that, I'll open it up for questions.
What can you tell us about the number of program and the demographics of the population?
Sure. Currently, we serve over 1,300 individuals. The majority of those are currently men, with lower representation of women, and that's our goal, is to increase that and make preventive reproductive health care more accessible and more robustly available in this community.
You said earlier that this additional funding would allow you to serve, did you say 100 or hundreds?
Hundreds more. Hundreds more. Additional questions? We have been having lots of conversations with different stakeholders in the community around how do we collectively lean into preventive care, and so this is what we can do in response, and this is the response to that.
I'm wondering if you've been in touch with colleagues in other counties around the state about the existence of or potential expansion of their reproductive health programs.
There are some health departments that currently offer or on the cusp of offering long-acting reversible contraception, and we have been a little bit slower, given capacity to do so. So we're entering that space now, but I think lots of folks are trying to figure out the appropriate response. Okay. Thank you.
Thank you all.